Good evening. According to the Department of Health and Human Services in Michigan, there has been a hepatitis A outbreak in Southeast Michigan. There have been 495 confirmed cases of hepatitis A in this past year, which has resulted in 419 hospitalizations and 19 deaths. This number represents a 7-fold increase of the rates of hepatitis A. My name is Danielle Hackla, and I have been a registered nurse for 10 years, and tonight I am going to speak to you about this outbreak. I'm going to provide you with a little bit of information about what hepatitis A is, the typical signs and symptoms, how the disease is contracted, and treatments for the disease. Hepatitis A is a viral hepatitis. It is caused by the hepatitis A virus. There are typical signs and symptoms of hepatitis A are nausea, decreased appetite, fever, body aches, abdominal pain, and jaundice. Jaundice is the yellowing of the eyes and skin. Children that contract hepatitis A typically do not have any symptoms. There is no treatment for hepatitis A, and there is no cure. Treatments consist of supportive measures. The alarming thing about this particular outbreak in Michigan is the rate of hospitalization. The 419 people that required hospitalizations due to this represents an 85% hospitalization rate. That is alarmingly high because typically hepatitis A patients do not require hospitalization. Hepatitis A, if not treated and supported, can result in liver failure and death. Hepatitis A is transmitted via person to person. The primary means of contraction is the oral to fecal route. That means that you have ingested food or beverages that have been contaminated by someone's fecal matter who has hepatitis A. This is usually a result of poor hand hygiene. 5 area restaurants have been noted to have an employee there test positive for hepatitis A in the past year. That means that there has been a large exposure rate in our area. The other means of transmission are via unprotected sex and IV drug use. Prevention. Prevention for hepatitis A. This is a completely preventable disease. Consists of a vaccine. The vaccine is a series vaccine. You get your first dose and then your second dose 6 to 12 months later, and that provides lifelong immunity. The other prevention is to not engage in unprotected sex and do not share any needles. So once again, I just wanted to say thank you for coming, that the reason we are here is to discuss the hepatitis A outbreak. We have the 495 cases in our area, 419 hospitalizations, and 19 deaths. The symptoms you may see are nausea, decreased appetite, fever, body aches, abdominal pain, and jaundice. Prevention: get vaccinated, proper hand hygiene, do not engage in unprotected sex, and do not share needles. And thank you for coming.